besides RAS and BRAF, and besides the sidedness that has been well now described and validated across different studies as far as its impact on prognosis and response to anti-EGFR therapy, I think HER2 targeting has become clearly another area we need to look into. Every patient, in my opinion, should be considered for profiling for HER2 amplification. SWOG 1613, a randomized clinical trial looking at trastuzumab pertuzumab versus cetuximab irinotecan with a crossover design, is currently recruiting for patients with second line and third line metastatic colorectal cancer with HER2 amplification. So that is an area that clearly affects only 2 to 3% of patients, but when you identify them, it is very important to consider HER2 targeting. I think another area that we see as far as targeted therapy that is important is realizing that there's a small portion of patients that is even smaller than MSI high patients who may benefit from immunotherapy. For example, the ultra-mutated metastatic colorectal cancer, POL-E mutations. These patients typically have a tumor mutation burden of more than 200, and they appear to be quite responsive to immunotherapy. So fusions is another area that is of considerable interest. We all realize that patients with NTRK fusions do respond to treatment. There's an FDA-approved therapy for those patients. They're rare, but comprehensive genomic analysis, in my opinion, is really a must for every single patient with metastatic colorectal cancer. We need to profile the tumor to identify the best treatment.